Dr. M. Srinivasan, Member Niti Aayog, our respected Chairman, dignitaries in the audience, my colleague at work, Sangeeta and Sunita, many other senior doctors who are attending today's function, dear members of the Apollo family. And when I say Apollo family, I'm actually talking about almost 200,000 people who have come together in multi-locations for this initiative with a single-minded agenda to just serve the people of our nation and to set a standard and a benchmark throughout the globe. And I think that is what has made today significant and it has made today special. After all, healthcare it's about caring, it's about focusing. And I think every milestone reached, every step we move in the right direction is in that single-pointed agenda of doing whatever we can to raise the bar on the delivery of healthcare. Always open, always here is a global first. It was conceived by our chairman, it was thought through by our chairman, who in his earlier days said that the emergency room should never be, it used to be called a casualty room, and he said it should never be a casualty, it should be an emergency room. Healthcare has to be able to reach every individual who needs it. So Apollo Hospital was born from that dream. What can we do to serve the public better? There was telemedicine, many other initiatives. But today's initiative is far more far-reaching than all that we've done over these years. And it truly is a global first, because nowhere in the world do people commit to the fact that all services will be open on a Sunday. All services will be available to people on a Sunday. And you may ask us, saying anyway they're the emergency rooms, but it's precisely why we don't want an emergency that always open, always here is being launched today by our chairman. It will have all services available to people. It will have the emergencies available, but anything which they need, which they don't have to wait for, a week slot, will come over the weekends, and especially on Sundays. And this is significant because in today's world, there are busy executives working 24/7, and they really wonder, how will I take my aging parents? How will I take my child to the pediatrician? How will my wife really get that consult which she needs unless I take off from work? And that becomes a reason to push things further and further till there are emergencies. And for this precise reason, we're saying that please don't wait, because events don't wait for anyone. Your health is your most important asset. We are there to serve you, and that is why we are available, we're always open, we're always there to serve you. But what is delightful is today, the entire Apollo system, which is 80 plus locations, multiple pharmacies, clinics are listening to what we're saying. So we will start by keeping the hospitals available on Sunday for routine work so that people don't have to wait. We will start by saying that we encourage you to take your preventive checkups. Don't wait for the weekdays and taking time off from work. We're there on a Sunday. Come as a family and prevent the onset of disease. We are available for you anytime if you want to call us in need. So I think this is what Apollo commits to, and it is probably one of the most significant announcements, launches, pledge by the entire Apollo family to raise the bar, to push ourselves further to deliver what we have to do. So I really want to thank the members of the media who've supported us in our journey for over 42 years. And today all of you have been there to let people know that healthcare is available to them. They don't have to wait, they don't have to hesitate. And of course I have to thank our chairman because he doesn't stop pushing us. And there was somebody who said that he doesn't know English because he doesn't know the meaning of the word no or not possible. So thank you, Chairman. The entire Apollo family of over 200,000 people are committed to this vision and to this dream. And to our friends who are there, thank you for your support and for being there. Namaste and Jai Hind.
This time is for you. where the only time and the time is for you. So this is exactly what we would like to launch today. That you know that the time we're all the time. So this is why we're always open and always there. Is the thing, and it happens to be for centuries, for decades. Sunday was considered as a holiday. It's good, everybody needs a holiday. But healthcare is no holiday. For health, there's no appointments. There's no good time, there's no bad time. There's no, that it will occur exactly at between 10 and 5 when all the hospitals are open, all the doctors are available. So it can occur anytime. So I think this is where we probably did. We saw that during COVID. We served during COVID, as you know, the 3,000 beds and over 5,000 hospital beds round the clock. So this is why today's event is going to make a significant thing, and I hope many hospitals in the country, or all the hospitals in the country, will follow this lead, and the world will follow it. They followed it, way back in 1990, when we brought the Boeing. I was asked to be on the board. So in that board, I passed a resolution with 6 of the members saying that we should stop smoking in Indian Airlines. So that happened. Indian Airlines stopped smoking. Today what happened? The whole world airlines has no smoking. So I hope this event that we are taking place today will be like that. Similarly, I did something like casualty. The day before the president was opened up, what all I went through to open the hospital. 5 years of struggle. I came to Delhi first time as a tourist. Second time I came to Delhi to bring this major healthcare service to our people, and 100 trips. But then all that today is behind us. Number of hospitals, Apollo has hospital, good hospital, there are another 200, 300 good hospitals in the country. So all of them are now following this. They all had, previously, the hospital had a board called Casualty. So the night before the hospital was to be opened by our President of India, State General Zail Singh, I saw the board. I went to them and they said, what do you mean? The patients are coming to you to become your casualty? So I changed the board to emergency. So the whole world has changed it to emergency. Well, like that, I think what we need is to think saying, we are in healthcare, and people should trust us. To be enabled for them to trust us, what can we do to make things better? I'm happy to say the journey of 43 years have been very, very, makes me happy, makes me strong, saying that, today, India, no Indian need to go abroad. I think I must have told you before, I'm a cardiologist. I came back from US, and when I came back, I could do everything that's possible in cardiology. But if we need to pay, the cardiologist can do only so much without intervention. Today, they can do intervention and do so many things, but that time intervention was not available. Only surgery was available. But people who needed that, very few could afford it. And I told the then Prime Minister, there are only 1 or 2% of the people whom the government and the rich can afford. But all other people are unnecessarily succumbing to this cardiac problem. And that's only cardiac is only one problem, but we know now today oncology is the biggest problem. But in all of these, I must thank, yes, they all say my daughters. It's not my daughters alone. It is a management team. It is the entire 125,000 Apollo family members and the 300 other good hospitals who made this huge transformation in healthcare so that no Indian need to go abroad for any treatment. You are happy?
So it's the seal of health, seal of happiness, available to you at the Apollo Hospital, always here and always open, ladies and gentlemen. Thank you so much, sir, for having revealed this.